For example, group therapy develops social supports, improves social networking, and even seems to reduce relapses for clients with substance use disorders, clients with eating disorders, and medical illnesses. Group therapy selection is challenging but very necessary. Clinicians and psychiatric nurses usually need to determine who wouldn't be a good candidate first. Then they can proceed to accept other clients. It seems a bit harsh, but it's easier to eliminate than try and remove the incompatible client from the group later. But in reality, it is hard to really find the perfect fit for any group therapy. The expertise of the psychiatric nurse in personality and observing interpersonal relationships amongst the clients makes a big difference in how a group will interact in the long run. There are certain characteristic traits that do make poor candidates for long-term group therapy. For instance, brain damage, paranoia, hypochondriac, addicts to drug and alcohol, acute psychosis, or psychopathic individuals do not make good participants of group therapy because it's very important for the individuals to be an active participant in the primary take of the group for logistical, intellectual, psychological, or interpersonal reasons. That's why these would be a bit of a challenge. This then leads me to discuss the reasons for premature termination. There are certain characteristics of clients that would drop out of group therapy. They range from conflict in scheduling or just moving to another town. That is why the initial interview, these sorts of questions need to be addressed to avoid such an incident later on. Another is classified as deviant-mindedness, which could be very quiet or very loud or disruptive. Very angry or those completely withdrawn members. Several clients have been known to drop out of group therapy due to conflict with intimacy issues like schizoid withdrawal, promiscuous self-disclosures, or pervasive fear of disclosure, and finally, unrealistic demands for attention. Listening to others voice their problems is also very hard for many others members to handle, which then can cause a person to leave the group. What they hear can upset them and can also make their mental well-being deteriorate even more. Many of these factors are very hard to predict in the initial interview process. But finally, another factor that could affect and cause a person to leave the therapeutic group is not being able to share the therapist as they had previously had individual therapy and find it difficult to transition away from that. All of these barriers for group therapy are very important for psychiatric nurses to understand, as it is not easy to find the right matches for members for group therapy. Sometimes it's just enough for many clients just to be able to partake due to the waitlisting and just because at that given time, these are their options. I remember when my husband started going to group sessions for how to live with a brain injury over 10 years ago. There were a lot of different people with different backgrounds, but all had one common factor. We all suffered from a traumatic brain injury. There were so many different personalities in this group, and I, for one, noticed it took a while for everyone to really relax and be comfortable with sharing and growing during all this. Many of the significant others or other family members were also involved in this group therapy. I, for one, knew that it was hard for Randy just because he was an introvert and didn't like groups or crowds. He knew he should go to these things to help him understand and benefit from it, knowing from the knowledge of the other members and what they go through. He really only attended because I was there with him. Otherwise, he would not have lasted as long as he did. Another factor was the group leader, who was very helpful, supportive, empathetic, knowledgeable about what brain injury was all about, and encouraged Randy to continue on with the group until he felt comfortable to attend another group for just the individual suffering with the brain injury, no one else. He attended that group until he found it difficult to get around and eventually had to drop out for health reasons. This experience showed me how important it is not to prejudge the group, as it can change as time goes on. No one can predict what will happen, but a psychiatric nurse who is aware of such limitations and obstacles can be better prepared and educated about what could and could not work for selected group participants. It would also seem that with experience and practice, it would only fine-tune a nurse's intuitive and interpersonal skills in understanding and getting the information needed during interviews to find the right fit for the right group.
The most important group counseling concept for a psychiatric nurse to master is the selection of group participants. Evidence shows that group therapy is at the least as effective as individual therapy. In the selection of group participants, clinicians do not select their clients, but instead deselect clients by determining which individuals in the group they do not believe will benefit from the group or be beneficial to others in the therapy group. To be a valid candidate for group therapy, one must possess a capacity and willingness to examine their interpersonal behaviors, to self-disclose, and to give and receive feedback. Unsuitable clients tend to be detrimental to themselves and to the entire group. The most important criterion for inclusion is motivation. The client must be highly motivated for therapy and for group therapy in particular. If there is a deeply rooted unwillingness to accept responsibility for treatment or an unwillingness to enter the group, that individual should not be accepted as a group therapy member. Another important criterion for inclusion is whether a client has issues with their interpersonal domain, for example, loneliness, shyness, social withdrawal, inability to be intimate, just to name a few. The client must, at the very least, be aware of these problems and have a willingness to change. In saying this, if interpersonal problems aren't obvious, group therapy can still be suitable for those who do better with the effective stimuli of the group. Another very important criterion for inclusion is the consideration of the other group members and whether they will mesh or not. An example from the text is that a depressed and suicidal client or stalker may benefit from group therapy, but their presence may be less effective in the therapy for other members. This is where the meshing between group participants is important, because the individuals may not understand where one individual is coming from, and it may delay and become a barrier to their own progress in therapy. Lastly, a very important criterion for inclusion is the therapist's feelings towards their clients. If the therapist strongly dislikes or is disinterested in a client, they should refer them elsewhere. Evidence shows that therapist hostility often results in premature termination in group therapy. Unfortunately, I haven't had the chance to work in an actual group therapy setting yet, but just from our cohort group experiences, I can say that selection of participants for group therapy would be very important. I see how there is such a variety of different personalities, for example, very bold, loud, opinionated ones versus quiet and laid back. Sometimes these personalities do not mesh, and it creates issues and barriers for successfully completing tasks and assignments. Another example I can offer was when we were doing our clinical in acute psych and some of the patients were going on a group walk. As soon as one of the younger patients, who was very manic, showed up, a handful of the group said that there was no way they were going on the walk if she was going. I found this very sad for the rest of the group, as a nice walk outdoors in the fresh air may have been very beneficial for them and to their recovery. So for this reason, I believe the most important group counseling concept for a psychiatric nurse to master is the selection of group participants.
I also believe that the most important group counseling concept for psychiatric nurse to master is the selection of group participants. Properly understanding the client's expectations and goals of group therapy before it starts will enable the client in finding the right fit for help. Many people need to weigh the positives and the negatives of a therapy situation before they're able to fully commit. The cost, time commitment, and the energy that a therapy group might be too much for a client. There's the addition of the discomfort of a group experience, including anxiety, possible frustration, and the perception of discouragement and rejection from other group members. These reasons alone will help clients deselect themselves for group therapy. Often, clients will need to satisfy 4 different personal reasons to stay in the group, thus making therapy successful. The 4 questions would be: does the group satisfy the personal needs of the client? A few questions the clients need to ask is: how great is my personal suffering? Is my suffering greater than the distress of actually being in the group? According to research, the level of a client's discomfort will dictate their perceived need for therapy. A low to moderate level of discomfort may not make the client feel that their problems are big enough to warrant the time, the financial and emotional investment that group therapy entails. Personally, I've seen many friends push their anxiety problems or depression under the proverbial rug due to the cost of sessions. The understanding of what therapy does and belief in its benefits would have a greater impact on the client's decision to join in or stay in a group. A long-term group setting might not be the best fit for a person in an acute psychological distress, yet a short-term goal-focused session could benefit them. Another question they might ask themselves is, does the client derive satisfaction from relationships with other group members? The allure of a group with others who have similar experiences and troubles is a draw to the group therapy setting. Although the development of interpersonal satisfaction may be a slow process, distrust in group members initially can be common. Through the process of growing group cohesiveness, the level of trust between the clients will grow, and in turn, they will create better interpersonal relationships. As a cohort of students thrown together to work as a team on group assignments, this posed a great challenge for us. Yet we learned more about one another, and as we began to trust one another, conflict was resolved so much easier. Does the client derive satisfaction from participation in group activities? Is another question that they might want to ask themselves. This is interlinked with the last question. Most of the time, if a client derives satisfaction from relationships, the participation of group activities are just an extension of that initial relationship. The last question that they might want to ask themselves is, does the client derive satisfaction from pride in group membership? So this is looking at the sense of belonging to something that might have a stigma attached to it. Is the client ashamed about their problems? If so, belonging to a group might elicit more shame. Yet they could also look from a different perspective, one that others might still be in denial, yet they're proud of the group and attacking their perceived problems. I've not yet been exposed to group setting, but if I look at my experience with our cohort group and have these questions been answered, am I a good fit for a group therapy session? So taking out my personal needs, I can say that I most definitely benefit from interpersonal relationship with my peers. I feel that we've taught one another many things about ourselves and each other, and I feel that we learn more about ourselves and each other with every passing group task that we are assigned. The selection of group members for group therapy is important because to create a group situation with clients who all have differing goals, different personal beliefs in what the group can offer, and different attitudes about interpersonal relationships, this can set the group up for disaster. If the client has a good idea about group expectations, goals, and desired outcomes, they will have a greater chance